Welcome to our guide on post-operative care following periodontal surgery. It's crucial to follow these instructions to ensure a smooth recovery and avoid complications. Let's start with some essential tips to protect the surgical site. Protecting the surgical site. Avoid stretching your lips with your fingers to the surgical site, as this can cause trauma and introduce bacteria to the surgical site. Keep your head elevated at all times, even during sleep, by putting 2 pillows behind your head for the first week. Replace gauze every 20 to 30 minutes until bleeding stops. It's normal to spot blood for the first 24 hours. Do not eat, drink, or sleep with gauze in your mouth to prevent choking hazards. Contact the office if bleeding is extremely heavy. Do's and don'ts. Do not swish or spit aggressively for the first 24 to 48 hours, as we want to maintain the blood clot over the healing site. Do not brush the surgical site for 3 days, however. The teeth can be brushed with a soft toothbrush. Do not floss in the surgical site for 3 weeks after surgery. Do's. If Stella Life Recovery Pack was given, use as directed on the side of the box. Using the head tilt roll technique. If chlorhexidine was given, use 2 to 3 times a day for 1 week. Stop after 1 week, it can stain teeth. If using a water pick, resume use after 3 weeks at the lowest level and continue to increase the strength gradually. Use the provided soft post-op brush following the day after surgery on the teeth and avoid the surgical site for 7 days. Resume normal brushing on the surgery site with your standard toothbrush after 7 days. Discard your soft post-op brush after 1 week. Stitches will dissolve within 1 to 4 weeks. Swelling. Use ice packs externally around the surgical site for 20 minutes on and 20 minutes off for up to 72 hours, at least 4 hours a day, with the first day being the most important. Do not place ice packs inside the mouth. Maximum swelling and bruising occurs 72 hours after surgery. Bruising can have various colors and may travel down the neck or up the cheek as it heals. If swelling or bruising persists after 72 hours, switch to warm compresses. Medications. Antibiotics. Complete the full course of antibiotics if prescribed. Discontinue if you develop hives or a rash and contact the office immediately. Pain. Expect pain or discomfort after surgery. Follow prescription instructions for pain medications. You may take the narcotic and Motrin together if prescribed. Rest. Get adequate rest. Avoid strenuous activities and heart rate elevating activities for 3 to 5 days. After the first 72 hours, you should start feeling better each day. Retainers. You can continue to wear your retainers or Invisalign trays immediately following your surgery. If you're feeling any discomfort, then contact our office directly. If you have a temporary tooth, inform us of any pain or pressure from the appliance in the surgical site. Additional adjustments of the temporary may be necessary. Diet simplified. Dietary suggestions following surgery for the first 14 days. First 24 hours, consume cold or room temperature soft foods only. After 24 hours and up to 14 days, introduce lukewarm, mushy foods. Avoid nuts, seeds, berries, crunchy foods, and hard bread for 1 week. Minimize extremely spicy and acidic foods. Chew on the opposite side of the surgical site, if applicable. Do not use a straw until your post-op evaluation. Thank you for watching our post-operative instructions video. We hope you had a wonderful experience at our office. For further inquiries, please contact us.